Hi everyone, my name is Antu, and today I'm going to do a presentation about elderly poverty and Medicare. The reason I chose to talk about this topic is because recently my father-in-law turned 65, and I was with him throughout the whole Medicare enrollment process. It was a good opportunity for me to learn not only about Medicare but also about its impacts to Medicare beneficiary. Elderly poverty and Medicare. The true cost of growing older in America is far more different than what we can see. First, I will go over some general information about elderly poverty and why it's a social issue. Then I will talk about social policy, Medicare, a program that plays a major role in elderly poverty. Elderly poverty has always been a major social problem in the US. Every year, thousands of seniors are financially struggling to survive. All their life has been about getting to retirement, but their healthcare expenses can dramatically turn their retirement dreams into a retirement nightmare. So, based on data from 2017, under official poverty measure, 4.7 million seniors aged 65 and over lived in poverty. But that number increases to 7.2 million based on the supplemental poverty measure called SPM. The difference is large due to the fact that the SPM deducts out of pocket medical expenses from income, while the official poverty measure does not. Let's look at some of the numbers and the extent of the problem in different areas. Social Security benefits are 90% of the household incomes of 21% of elderly married couples and about 46% of elderly unmarried individuals. One third of elder household has no money left over each month or is in debt after meeting essential expenses. Million household with an adult aged 65 or older experience food insecurity. 3 out of 5 older adults who are eligible for the Supplemental Nutrition Assistance Program are not enrolled. Approximately 3.5 million senior homeowners are underwater on their loans and have no home equity. So let's look at the 2016 Elder Index. This is based on US average, and you can see single elder and elder couple under single elder column. For a single elder person in good health, the average monthly healthcare expenses is about $390, which is the second biggest expense after household expense. There is a correlation between elderly and healthcare costs. The elderly tend to need more medical care as they get older. That's when Medicare plays a crucial part in the senior population. So, what is Medicare? Medicare is a federal health insurance program funded by payroll tax, beneficiary premiums, co-pays, and deductibles, and general U.S. Treasury revenue. It is administered by the Centers for Medicare and Medicaid Services. It provides health insurance for Americans aged 65 and over, younger people with some disabilities, as well as people with ESRD and ALS. Medicare covers approximately one third of all Americans, and it accounts for $4 of every $10 that is spent on healthcare in the US. According to Kaiser Family Foundation KFF 2017 report, 18% of the US population about 57 million beneficiaries are enrolled in Medicare program. The number of people enrolled is expected to increase to over 80 million by 2030 as the last baby boom generation reaches into Medicare age, more than double compared to 2000 enrollment. Let's talk about the history of Medicare. So, before Medicare created, only about 60% of American seniors had health insurance. One of the primary reasons for this was because coverage for individuals in this age category was unaffordable. Because of this, roughly 1 in 4 seniors went without medical care at all due to cost issues. Medicare was signed into law on July 10, 1965 by President Lyndon Johnson with two main goals are to ensure health care coverage for elderly and disabled beneficiaries and protect them against financial hardship due to health care costs. Over time, Medicare has undergone several changes. In 1972, Medicare was extended to include younger people with permanent disabilities, as well as those with end-stage renal disease. In 2003, President George Bush added prescription drugs benefit to Medicare, which is known as Part D. And in 2008, Congress enacted additional legislation titled Medicare Improvements for Patients and Providers Act. This act addressed issues to Medicare Part D and changes to Medicare Part C. So Medicare has 4 parts. Part A provides inpatient coverage. Part B provides outpatient services. Part C refers to the Medicare Advantage program, provides an alternate way to receive Medicare benefits. Part D provides prescription drug benefits through various private insurance companies. So, why still poverty? Even with Medicare, many older Americans face large out of pocket healthcare costs. First, most pay premiums for coverage under Part B and Part D of Medicare. Second, they may pay premiums to private Medigap plans or to Medicare Advantage plans to cover items not covered by traditional Medicare. Third, they must make direct payments to doctors, hospitals, and nursing homes for services not covered by their health insurance. Original Medicare does not cover dental, vision, hearing aid, and many other medical equipment. While Medicare has been considered a success, there's still much more that can be done. Making it more accessible to everyone is an example. As legislators continue to seek new ways to reduce the cost of Medicare, many new proposals for Medicare reform have introduced, such as raising the Medicare eligibility age from 65 to 67, raising Medicare premium for higher income beneficiaries. Higher income beneficiaries should pay a larger share of the total premium to slow the growth of Medicare costs. Negotiating prescription drugs prices require drugs manufacturers to provide Medicare with the same rebates or discounts as those Medicaid receives for drugs purchased by certain low-income Part D enrollees. For many people, growing older once meant living with less income. Poverty is considered a risk factor among old people. The cost of healthcare has been rising much faster than both the general growth rate of the economy and the increase in Social Security benefits. The healthcare program that is designed to help senior citizens like Medicare should be expanded, and out-of-pocket costs should be reduced or eliminated.
So we all will grow old. We all will become senior citizens one day. I hope this presentation helps you to understand more about Medicare as well as elderly poverty. And if you have any question, please comment below or you can email me. Thanks for watching. Bye bye.